All right, hello everyone. Welcome to Pre-Health Shadowing. My name is Jennifer. I am lead of outreach, and today we have Nicole with us today. I will be introducing who we are, and then after I'm done with this brief presentation, I will pass it over to Nicole to tell us about her career pathway to being a pathologist assistant. Okay, so like I said, hello, we're Pre-Health Shadowing, an international nonprofit organization. Our mission is to empower aspiring healthcare professionals by providing virtual shadowing opportunities. We're also really excited to have you here be part of our community. Your participation and support is a critical component of moving our mission and our goals forward. We have closed captions to accommodate students of all abilities and needs. If you have any ideas how we can be more accessible, please make sure to email us at info@prehealthshadowing.com, save us on a contact, keep us out of spam, join our email list, and never miss a session. Another thing is if you want to make sure that you're always on schedule with our who to shadow next. We have a bunch of social media, like Instagram, we have TikTok, we have Twitter, we have YouTube and Facebook, and we also have LinkedIn. And if you also want to share about this specific experience, you can post it on LinkedIn and make sure you tag us at Pre-Health Shadowing, and we will make sure to post it. All right. We host students from all over the world. You want to let us know where you're calling from so we know where you're at. I'm from Los Angeles. Feel free to put it in the chat to let us know where you're at. Okay, Boston, Atlanta, Greensboro, North Carolina, Sylmar, California, another North Carolina, Arizona, Kansas, Texas. Normally have a lot of people from the West Coast, but we have people from the Midwest and Texas, Massachusetts, and the East Coast. Awesome. Okay. If you're interested in being in part of pre-health shadowing, you can. It's 100% remote, and you can register at our website. You can create your own schedule. It's really easy, and it's something that would really look good for college applications and also show initiative and doing something really cool that really helps a lot of people out. Also, if you want to, we're also recruiting for leadership team, and it's open to everyone. This is your chance to apply your skills, learn new ones, and make a real impact, all from the comfort of your home. It's 100% remote. Just head to our website and fill out the application there. These are the leadership roles available. If any of these interest you, we have lead of grants, fundraising, video production, leader research program, recruitment. I'm part of the outreach team, and I'm really enjoying it. But if you feel like there's something that we might not have that you can add, also please feel free to add that. And once again, if you follow the link, you'll be able to access all that. Also, we have a high school program. So if you're in high school, it is both a fantastic way to gain valuable skills and insights in both leadership and healthcare field before you have any step of foot in college campus. If all you need to do is fill out the interest form available on our website. All right, if you can donate. Our entire operation relies on generous donations, and it's an invaluable time contributed by our dedicated volunteers. So if you can even donate $1, it would be really helpful. That's for like our LinkedIn, YouTube, and other things that that isn't free. So we'd really appreciate if some of you can donate. If you can't donate, that's okay. You can donate your time. Also make sure to type in your questions in the chat, and we will make sure to answer them at the end of the presentation, or if we didn't answer them, we can answer them through email. All right, another thing is you want to take good notes because we do have a quiz and you also get a certificate after. So you want to make sure that you take good notes so that you can pass the quiz. The quiz is 2 tries, but I'm sure once you take good notes, you don't have to retake the quiz, and that's also good. Okay. All right, the last thing is we want to have our cameras on because we want to feel like this is an engaging environment so we can see each other's faces, and it just makes it a little bit more fun instead of having just black screens. Okay, so that's my little spiel, and now I'm gonna pass it over to Nicole, and she can tell us about her experience. Let's see, sorry, stop sharing. There you go. Now it's Nicole.
Alrighty, hello everyone. Let me share my screen. Okay, are we good? Everybody can see this okay? Wonderful. I see some head nods. So it's so lovely to be here. My name is Nicole Struthers. I am a board certified pathologist assistant and medical laboratory scientist. And I just wanted to thank Pre-Health Shadowing for inviting me. This is such a great organization, and I would have absolutely taken advantage of this as a high school student and as an undergraduate student trying to figure out what I wanted to do. So this is a really great organization. So I commend what you ladies are doing. All right. So today we're going to talk about what exactly is a pathologist assistant. We're kind of this hidden entity of the healthcare profession and what you need to do in order to become a pathologist assistant, and then kind of my journey to finding this career and other trajectories that individuals can take. So a little bit about me. Let me get rid of this. Oops. So I did my undergraduate studies at Northern Illinois University. I received my bachelor's in medical laboratory science. So a little bit different than what I ended up doing in the long run. After I finished my undergrad, I went to Rosalind Franklin University, which is actually where I work now. So it's kind of full circle. I was a student there several years ago, and now I am a faculty member. So after I received my master's, I went and worked at a small community hospital out in Rockford, Illinois. I'm out in Chicago, by the way. It's lovely to see that there's so many individuals from all across the United States joining us tonight. Um, so after I worked in a community hospital, I was like, I really want to be a part of a bigger team. I want to get into teaching residents and other uh, individuals in the pathology lab. So I joined Endeavor Health, which is out in Evanston, Illinois. And then I realized that my favorite part of my day was the teaching aspect. So I waited for an opportunity to become available at RFU, and now I am part of the faculty there. So no longer work full time in the hospital setting. I still work in the hospital as a per diem, so on an as needed basis. But my full-time role is now in the classroom. So pathologist assistants, like I mentioned, we're kind of the hidden piece of the puzzle. There's so many other aspects of healthcare, and people don't realize that we exist. They think that specimens are handled by either nurses or the doctor or surgeon, but there's this very niche aspect of medicine and pathology, and that's where we come into play. So this is the very lengthy definition of what exactly a pathologist assistant is. This is from our professional organization, the American Society or American Association of Pathologist Assistants. So a pathologist assistant is a highly trained allied health professional that works under the direct supervision of a physician, which is typically a pathologist. And we're responsible for the gross examination and dissection of anatomic pathology specimens. We manage frozen sections, and then we perform postmortem examinations as well. So we'll get into all of those components as we get through the lecture here. So if you think about the name of this profession, pathologist assistant, it's very similar to a physician assistant. But physician assistants, they specialize in every other aspect of medicine, so surgery, pediatrics, oncology, but they don't work in pathology. So pathologists, after physician assistants, this position was created, they said, hey, I'd really love a physician extender too. So that is where we all got started, was essentially pathologists saying, I'd really love some help in the pathology lab. So that is kind of the history behind the profession. It's a very young profession in relation to, say, being a medical doctor. This profession has only been around for about 50 years. So, in comparison to a doctor that's been hundreds and hundreds of years. So, getting into the scope of practice for a pathologist assistant, we work in the pathology lab, but pathology in a hospital setting is split into two areas. So there's the clinical side of pathology, and then there's the surgical pathology side. So pathologist assistants work on the surgical side. So any specimens that are coming out of the OR or any biopsies that are done in a clinical office and our outpatient office, the tissue is being sent to surgical pathology. Versus on the clinical side, that's where medical laboratory scientists work. And specimens that would be sent there would be like blood and urine specimens. So there's two avenues in pathology, and pathologist assistants are hanging out in surgical pathology. So our main job is doing the macroscopic description and dissection of all of those surgical pathology specimens. So we will gross the specimen. So I'll get into what exactly grossing is later on. But that's our primary job as a pathologist assistant. But we're also trained to perform autopsies, but that is a much smaller component of our day to day. So where exactly is the tissue going? How does it get from point A to point B and end up getting a diagnosis for the patient? So firstly, the patient will have either a biopsy or a surgery performed by a surgeon or by a clinician in an office. Once they have that sample, it gets sent to the surgical pathology lab. In the surgical pathology lab, it's handled by either a pathologist assistant, a pathology resident, or a technician, but everybody has a different amount of training. So the pathologist assistants receive a master's degree versus a technician would typically be an individual with a bachelor's degree. So the level of specimens that a technician can handle are much less complex. So they're biopsies that maybe don't need to be sectioned or things that aren't malignant, versus a pathologist assistant is going to be handling those much more complicated and complex cases. After the specimen has been reviewed by someone in the pathology lab, we are the ones that are choosing which samples of tissues get sent and are looked at under the microscope by the pathologist. So we select tissue and they get submitted in these little plastic squares. They're called cassettes. The tissue is then processed in a separate department of the hospital called histology. And histology technicians are the individuals that are embedding the tissue, they're cutting the samples. And once they cut the samples on this device here, it's called a microtome. The tissue is embedded into a paraffin wax, and on the microtome, the tissue can be cut into this very thin ribbon of wax. The tissue is then placed on a slide and stained, and the pathologist does the microscopic examination. Once they have the slides, they can look at the tissue under the microscope and they create the diagnosis for the patient. So, what exactly is grossing? You've heard me use that word a couple times, or the macroscopic examination. So that's exactly what we're doing. We're looking at the tissue in front of us. We are the eyes and hands of the pathologist. We're often the only individuals that actually see the tissue that is resected from a patient, and the pathologist is only seeing the microscopic component. So we're the eyes and the hands and the ears of the pathologist. When we receive a specimen, we usually are wearing a headset and we're talking into a computer, and we're describing everything that we see. So we are responsible for being the anatomy experts, the oncology and pathology experts of every single type of organ and organ system in the body. And we are very well versed in all of the pathologies and the normal in every single specimen. So we have very specific protocols that we have to follow for each organ system in order to know what we're looking at and being able to choose sections that we're submitting for the pathologist to review under the microscope. So what we're looking for is not only the normal tissue. We want to describe what we're seeing in the normal, but we're looking to see why exactly was that specimen removed. So we're trying to prove or disprove if there's any pathologic disease process, whether it be benign or malignancy. So in this image here, this is a picture from one of our labs that my students do in their didactic year of the program. So this student is grossing a simulated lumpectomy specimen. So a lumpectomy would be a partial resection of breast tissue to remove either a benign or a malignant pathology. So we talk about what we see on the outside. And then if you can appreciate, there's some colors on the outside of this tissue. So we use special ink to dye the outside of the tissue to mark our orientation. And it's really important for the tissue to be appropriately inked. So we maintain that orientation, but also to tell the pathologist, this is a very important surface. So we have to mark what's called a margin and determine if the margin is clear of any pathologies. So a margin is anywhere that the surgeon or clinician cuts in order to remove the tissue from the body. So if there's a cancer present at one of those margins, then there would still be cancer in the patient. So it's very important for us to maintain our orientation with that inking and making sure that we are showing the pathologist what all of those margins are. So when we're going through our dictation, we work from outside to inside the specimen, and we're describing everything that we see, from anything that's diseased and anything that's normal. Once we give our descriptions and all of our measurements, then we submit those sections in the cassette that go to the pathologist. So we have to be very well versed in all of the staging criteria for every single type of cancer and organ system in order for us to know which sections we have to submit to the pathologist in order for them to make the most accurate diagnosis for the patient. So in this lumpectomy specimen that was simulated, the students were able to go through and locate their pathology and demonstrate their pathology to our simulated pathologist and showing all of their margins. And then they write their cassette summary. The cassette summary lets the pathologist know exactly what piece of tissue and what we want them to see is in each individual cassette. So outside of grossing, we also are trained in specimen photography. So we have to take photographs in order to demonstrate what we see at the bench in surgical pathology, and to make sure that we're conveying everything about the specimen to the pathologist. All of this information, the dictation, our cassette summaries, the photographs, all of that remains part of a patient's chart forever. The tissue, the blocks, and the blocks we hold on to for about 10 years, and then the slides we hold on to indefinitely, versus the tissue we only keep for about 2 weeks. So we have to be sure that we catch everything when we have the specimen out in front of us, because we may be the only individuals that ever see that specimen in its entirety before it gets disposed. So this is an example of what a dictation could look like. So all of the information that we provide here, the pathologist utilizes to correlate what they see under the microscope and put together a final diagnosis for the patient. So we talked about, so this dictation correlates to this image here. So this is an example of what's called a radical nephrectomy, or the extensive resection of an entire kidney. This instance also has an adrenal gland that's hanging out up here. So we talked about what the specimen is that we received. So we received a kidney with this attached adrenal gland and ureter. I have to be able to identify which kidney this is. Is it my right or the left? Which direction is up versus down, which is right versus left. I have to be able to identify that this is my tumor here, and there's so many important relationships with this specific organ system and disease process that I have to be aware of in order to convey all of the accurate information to the pathologist. So again, here's our dictation and then an example of what our cassette summary might look like. So we have to be experts in anatomy. We have to know all of the ins and outs of all of the different organ systems. So that last kidney that we saw, that has a completely different type of cancer than what this kidney does. So there's two different cell types in a kidney, the cells that make up the actual kidney structure, your renal parenchyma, versus the cells that line our ureter. And since there's two different cell types, there's two different types of cancers that we can have. So our last one was a renal cell carcinoma versus this mass here in the ureter as a urothelial cell carcinoma. This is an example of a total hysterectomy with an endometrial adenocarcinoma. So our cancer is here in the endometrial cavity. We have our cervix down here, our endocervical canal, and then there's multiple different cell types in a uterus. So there's the muscular layer, there's the actual glandular layer, there's different cells on the cervix. So all of those different types of cells can result in different cancers. So being able to identify all of the anatomic structures and understanding what the different cancers that can be present and the relationships that we have to document to prove or disprove what stage this cancer would be. So this is not a malignant case. This is a very typical specimen that we receive in the lab. So we have a singleton placenta. So placenta would be the organ that's generated when there is conception and the baby lives inside the amniotic sac of the placenta. So we get those all the time. There's babies born all day, every day of the year. So we have so many placentas that we see. But then we also have a multi-gestational pregnancy. So we have a monodi or a monochorionic diamnionic placenta here, which would be from a set of twins. And if you can appreciate, the vasculature is colorful. It's not colorful when it comes out of the body, but we have to inject the vessels with ink in order to see if there's any vessels that connect from twin A to twin B in order to determine if there's something called twin-to-twin transfusion syndrome. So this is a really cool thing that we get to do in the gross room in order to make sure the babies are healthy and that neither of them have this syndrome. So the big part of what we have to document within our gross descriptions, we have to make sure that we provide accurate information for each type of cancer based on the staging system. So you've probably heard, oh, Susie has stage 2 breast cancer, or Carl has stage 3 colon cancer. That staging criteria is based on the actual organ itself. So we use what's called TNM staging criteria that is used throughout the entire world. So it's an international staging system. And depending on the organ system, it might be based on invasion. So this would be an example of a colon cancer. Colon cancers are staged purely on invasion, versus a breast cancer is staged based on the size of the tumor. So we have to be very well versed again on all of the staging criteria in order to provide the most accurate information for the pathologist to make the most accurate diagnosis. So back to that kidney case. So this is what the final diagnosis looks like. So we're, as a pathologist assistant, we're not the ones that are providing the diagnosis. Even though looking at this, I know that this is a clear cell renal cell carcinoma. I don't sign out the case for the patient. The pathologist, as a medical doctor, they have the authority to provide a diagnosis. So using the information that I provided in a gross dictation and the sections that I submit and the photograph, they put together the final diagnosis. So this is an example of what that might look like. They are the ones that put together the pathologic stage based on the information that we provide and what they see under the microscope. So the grossing role, again, that's our main job as a pathologist assistant. And when you think of the word gross, usually it's used as an adjective, right? But we use it as a verb. So that is what we do day in and day out. We're grossing in the surgical pathology lab. But another large part of our job is managing intraoperative consultations or frozen sections. So, an intraoperative consultation is when a surgeon is in the middle of a surgery and they come across something that they need answered right away. So they have a question that, depending on what the answer to that question is, will change the trajectory of the surgery. So what they'll do is if they remove a specimen, they will send that to us in surgical pathology and they say, hey, I have a frozen section for you. Can you provide me an answer? I'll be waiting. So with that, when we get an intraoperative consultation, we have 20 minutes in the surgical pathology lab from the time that we receive the specimen to the time that the pathologist has to render a diagnosis back up to the OR. So generally, their questions are, is my margin positive or negative? Or they came across something that maybe they're not sure what it is. If it's a metastasis, so the tumor has spread from its original location to somewhere else, then that may stop the surgery. This happens a lot with Whipple procedures. The Whipple procedure is the removal of a pancreatic cancer. If they were to come across a little nodule in the abdomen that could possibly be a metastasis, they'll send that to us. And if it is a positive lesion, it ends up being a cancer, then the surgery would stop. Because at that point, the patient's cancer has spread throughout the body and surgery, the risks outweigh the benefits at that point. So when frozen sections come in, we have to stop everything that we're doing in order to make sure we get the answer back up to the OR within that 20-minute time frame, so they can proceed with their surgery. So another part of our scope of practice is performing autopsies. So with autopsies, we can be a part of any portion of the procedure, whether it be pre-analytical, analytical, or post-analytical. So some of our pre-analytical tasks would be making sure that we receive proper consent for the autopsy. There's a very specific line of next of kin that we have to make sure we follow in order to ensure that the proper consent has been given. So if someone were to pass away, but their daughter is the one that provides consent, but they still have a living spouse, the daughter can't give consent. So we have to make sure we are receiving proper consent in order to proceed. We also are responsible for reviewing patients' medical records to kind of get an idea of what was going on in their life leading up to death. And then this will provide guidance for us during the autopsy and gives us an idea of what exactly we're looking for. We also are trained on how to perform the entire autopsy from start to finish. So doing the external exam, looking at everything on the outside, documenting everything, taking photographs, Then we're also trained on the actual internal exam and evisceration, so the removal of all of the organs and the tissue sampling. So just like we do in surgical pathology, we also sample tissue in autopsy pathology to be submitted and processed to look at under the microscope. Then post-analytical tasks, we are trained in preparing reports. There's two main types of reports that are submitted after an autopsy is completed. There's a preliminary autopsy diagnosis and a final autopsy diagnosis that are written up either by a pathologist assistant, a resident, in conjunction with your attending pathologist. So with the reports, we again are not the ones that are signing out the case, but we play a big part of the case. We are there from start to finish, so we can write up these reports, but we are just not the ones that are signing them out. We also prepare the bodies to release to the funeral home after the case has been completed. With that, the bodies are either cremated or they go through a burial process. So at that point, all of the tissue, all of the samples goes away. So we have to make sure that we have everything that we need in order to determine a patient's cause of death. Oh, I lost my mouse. There we go. Okay, so what does a typical work-life balance look like for a pathologist assistant? We generally are working Monday through Fridays. There are some labs and hospitals that are open on the weekends, but typically it's just a Monday through Friday situation. The great thing about surgical pathology is that it's closed on major holidays. So we don't have to be fighting to take off Christmas or take off 4th of July. The lab is closed. So we aren't working, which is really great. There's typically not on call. I will say at some academic centers, if they have an autopsy service that the pathologist assistants are responsible for managing, there may be a rotating call service where you have to be on call to come in to handle, say, an autopsy case on a weekend. But typically, it's not an on call job like a surgeon might have. We are salaried workers, so our checks look exactly the same every single week. So whether we're working 40 hours or we're working 50 hours, we get paid the same. So with that, we typically work about 40 hours a week. But if we have a case that comes in at the end of the day or it's particularly busy, we have to stay until all of the work is finished to make sure that we have appropriate turnaround times to get those samples out and processed so the patients aren't waiting weeks and weeks and weeks to get their results back. Many of their results determine the next course of treatment, and we want to make sure that they get treatment as soon as possible so they have the best prognosis. So shifts vary. We're typically in the hospital during the daytime, but there are some reference labs that might have later shifts or overnight shifts, but typically it's an 8 to 4 or 9 to 5 type of job. So our primary role is grossing, doing that macroscopic examination, but we do manage autopsies. We have the frozen section responsibilities. But since we are mid-level providers, a large part of our job is teaching. So not only are we teaching medical students that might rotate through and are shadowing, we also are teaching pathology technicians, pathologist assistant students, and pathology residents. So the residents that eventually are going to go on to be our attending pathologists. As pathologist assistants and the experts in surgical pathology, we're actually the ones that are teaching the residents. So with that, our being a mid-level provider, we also have a lot of admin responsibilities. We can move up in kind of into supervisor roles, into managerial roles, but even just as your standard pathologist assistant, there are some admin things that we may have to do, such as continuing education credits or maybe presenting at a conference. So we have admin responsibilities as well. So I often get asked, what type of qualities should I have if I'm thinking about pursuing this type of job. The main one being that you want to work in a pathology lab. It is not for everyone. It is a dirty place. It is definitely a dirty job, but it is, I think, the best job. So having the desire to work in a pathology lab is definitely number one. And being passionate about healthcare. If you notice during the presentation, at no point did I say that I have direct patient contact. The only time I see a patient is if they're in the morgue in the autopsy suite. So I don't have direct patient care at all. I receive components of a patient that I treat with the utmost respect as I would if I were bedside. However, that's not what I wanted to do when I wanted to go into medicine. So this is a great job if you don't want to have direct patient care, but still want to make an impact in their healthcare. Being a team player is a huge component of what we do, especially if you're at a big academic center. You're not the only one that's in the gross room. You're working with other pathologist assistants, you're teaching, you're working with pathologists, you're on the phone with the surgeon, you maybe are working with the nurses, the radiology team. So it's a very interprofessional role. So being a team player is a huge part of being a pathologist assistant. So with that, having strong interprofessional skills, I'm often, or when I was in the hospital, I'm often on the phone with the surgeons, with the nurses, making sure that everything is copacetic for my case. So strong interprofessional skills is key to this job. Being able to communicate efficiently via dictation. So making sure that what I am saying into my computer, into my headset, that's ultimately getting typed up into that paragraph makes sense. So the goal for us is to paint a picture for the pathologist to re-envision what the specimen looks like, because they might be in an office across town and they aren't even anywhere near the gross room. So making sure that you communicate efficiently and effectively and concisely to the pathologist so they're not reading a narrative and they can envision what you're talking about. The gross room is a very hustle and bustle environment. So being able to multitask is very important and being able to work under pressure. So those frozen sections, when they come in, again, you have the 20 minutes to get it done. Not only do you have such a short window of time, you might have a surgeon sitting right next to you and they are saying, okay, you got to hurry up, got to hurry up, got to hurry up. So making sure that you can work under that pressure is a huge part of being a PA. Working independently. So again, we work under the supervision of a pathologist, but they're not coming in and checking and saying, hey, this is what you need to do today. You have to be able to manage your time efficiently. I think being detail oriented is one of the most important aspects of this job. Many pathologist assistants are, quote, type A. We're very structured and organized to make sure that we don't lose orientation for a case, that we check off all of our mental boxes in order to provide the best patient care. So some common misconceptions about being a pathologist assistant, that since we don't have that direct patient care, that we don't have a vital role in patient care, which is completely false. I treat my specimens with the utmost respect to provide the best outcome for my patients. I treat them as my patients, even though they don't know that I exist. And that's okay. I like it that way. But I want to make sure that they are getting the best possible care. So even though I don't see them, it doesn't matter. We still play a very important role in their care. The information that we provide will change what type of treatment they ultimately end up receiving. So we play a very important role in their care. Many individuals, when they hear about what we do, the only thing that sticks in their mind is that we do autopsies. They're like, oh, a pathologist assistant, all you're doing every day is autopsies. While there are some rules that you are strictly an autopsy pathologist assistant, that is a very, very small subset of pathologist assistants and not our main job at all. So while that does exist, our main role is grossing in surgical pathology. With the thought process that we only do autopsies, many people go right to CSI or there's scene shows on TV. And this is an even smaller subset of what pathologist assistants do. Um, there's only about 3,000 certified pathologist assistants in the United States. And out of those 3,000, there's probably about 30 that actually go out on scene with a medical examiner. So while it is becoming more common, it is a very, very niche aspect of our role. So it is not an accurate representation of what we do in the day to day. So where can you find us? We can be in many places, primarily in the hospital setting, in the gross room or in the morgue, but we can work in medical examiners' offices, in the coroner's office. We can take roles in lab management, take roles in research. There are some PAs that have left the healthcare setting and they actually go and work for IT companies like Epic. Epic is a big laboratory information system. So many, or not many, but there are a handful of PAs that end up going to work in IT or even sales. There was a faculty member at RFU that decided to take a different path, and now she works for Mopec, which is a company that produces some of the hardware and devices that are in a surgical pathology lab. So we can be in many places, but primarily we're in the hospital. So how do you become a pathologist assistant? The only pathway to become a PA is receiving a master's degree in Pathologists Assistant Studies. So where I work at Rosalind Franklin University, we do have a pathologist assistant program. So for our program, it's 22 months, so just short of 2 years. It's a full-time program, and the first 12 months is all in the classroom. So it's all the didactic work. And then the last 12 months or 10 months, our students go out to clinicals where they're actually practicing under the guidance of a certified pathologist assistant or pathologist. And they get to practice all of their skills before they leave and graduate. After graduation, you are eligible to sit for a national certification exam, which is given by the American Society of Clinical Pathology. If you've completed your master's degree through a NACLS accredited program, you're eligible to sit for this exam. So in order to practice, you have to become certified after you graduate. So I put together this map to demonstrate where all of the pathologist assistance programs are. So like I mentioned, there's only about 3,000 PAs, certified PAs. And within the last 10 years, the amount of programs has actually doubled. So we're up to 21 programs in the US and Canada, and that is in the world. There's only 21 programs in the world. And about 10 years ago, there was only 9 in the US and 2 in Canada. So now there is, I believe, 17 or so in the US and 4 in Canada. So while it is a small field, it's a young field, it is growing exponentially. So all of the light blue locations here represents one pathologist assistant program. The dark blue are the programs in Canada, and then we have 2 programs in the US that are new, and they haven't become fully accredited by NACLS yet, but they are in the process of doing so. So it is growing rapidly. So all of the programs have different prerequisites, but I can discuss kind of how you would be admitted or apply to the program at RFU. So you have to complete a bachelor's degree program, and you would think that it has to be healthcare based or science based, but it actually doesn't. As long as you have the prerequisites, you have your prerequisites in biology, human anatomy, microbiology, chemistry, organic chemistry, a college level math class, and an English class, you can have any degree. You can have a history degree, you can have a veterinary medicine degree. As long as you meet those prerequisites, you're eligible to apply to our pathologist assistant program. On average, our students or our applicants that are accepted into the program have an overall GPA of about 3.4, but we are particular about the science GPA. So we want to make sure that your science-based courses you perform well in. So we pay attention as well to the science GPA. So with your application, we like to see at least 2 letters of recommendation. And when you are thinking about who you should ask to write a letter of recommendation, we like to see these either from a pathologist or a pathologist assistant that you may have shadowed or worked with, or a science course professor that you worked with, or maybe a research um, uh, program that maybe you worked for. So think about who you would have write a letter of recommendation that meets those criteria. With our application, we also require applicants to submit 5 narratives with accompanying photographs so we can get to know you a little bit, and kind of see what makes you tick and see why you want to be a pathologist assistant. So this is unique to RFU's application. We like to see students or applicants that have some form of evidence that they understand what they're getting into. So they have some form of shadowing hours, whether it be in surgical pathology or in autopsy pathology. And our strong applicants have over 8 hours of shadowing. So something to keep in mind when you're thinking about pursuing this. So some questions that we get about RFU's program admissions specifically. Many students that apply to a master's degree program, they have to submit GRE scores. We do not require GRE scores for our application. We don't believe that it is an appropriate measure of who you are as a student and as an individual. So we don't require GRE scores with the application. Our application is open from the 1st of August to the end of January every year. So we admit individuals on a rolling basis. So the earlier that someone applies, the higher likelihood that they would be accepted into the program. So with the interviews going from about November to March, our program starts at the end of May every year, and then goes through the 12 months of didactic work and then 10 months of clinical work right after that. Our interview format is a little bit different. You're not sitting in a room and you're being asked questions by a panel of the faculty. We use an interview format called the multiple mini interview, or an MMI format, and that's where it's scenario based. So you're asked a question and you're given a scenario, and you have to think about how you would react or respond in that scenario. And we're looking for specific traits and how you would maybe handle specific situations. So the narratives are a really great way for us to get to know you and outside of the interview format, since we're not asking those typical get to know you questions during the interview. So RFU's program is the largest program that is available. So we take 32 students every year. Most of the programs, I would say, take about 12. And then there's a program in Connecticut that takes about 20 every year. So I think 12 is about the average, and some programs are even smaller and they maybe take maybe 2 or 4. So with that, those 32 seats, they are very competitive. We have about 160 applications every year, and we only have 32 seats. So it is a very competitive process to get through. So this is kind of what the curriculum looks like for just in general, the pathologist assistant program, but this is our curriculum for year 1 at RFU. So in the summer, our students are going through clinical anatomy. So they are doing cadaver dissections and they get very intimately acquainted with all of the anatomy of the human body. They have medical terminology, and then our clinical correlation series. So this is the class that we teach all of the ins and outs of every single organ system and how to function as a pathologist assistant. Our seminar series is our professional development series. So everything that you need to know to be a very well-rounded pathologist assistant outside of the gross room. So each quarter looks similar to our summer quarter with the addition of our interprofessional courses. So we have our general pathology and structure and function. So our students take these classes with the medical students at RFU, the podiatry students, physical therapy, physician assistants. So not only are they in classes with their cohort, but they also learn from with and about other students on campus. Our spring quarter is by far the most difficult for our students. They are the most busy. So on top of their clinical seminar and their other interprofessional courses, we add in neuroscience and autopsy pathology. So they will go through and perform an entire autopsy from start to finish over the course of the quarter. This is kind of the setup for the curriculum. In the second year, our students go out to clinicals. So at RFU, our students are placed at a clinical site that can be anywhere in the United States. So each one of these orange dots represents at least one clinical site that we have. So while most of our sites are located within the Midwest, we do have many sites in Texas, in California, in Los Angeles, and in the Bay Area. We have a site right now in Florida, but every year these change. So with the field being primarily female dominated, many of our preceptors go on maternity leave. So we could lose a site due to a preceptor not being available or maybe due to construction. Another situation that we see is that a clinical site may hire one of our students, but then there's no longer a space to take a new student. So they might not be available the following year. So every year this list changes a little bit, but our students, they go to their clinical sites for their entire 10 months. The caveat to that is if they go to a 5-5 split, so they go to one site for 5 months and another site for another 5 months, but those two sites would be in the same geographic location. So we're not asking a student to move to California for 5 months and then come back to Chicago for 5 months. So the way that we do our clinical rotations is a little bit different in comparison to some other pathologist assistant programs that they send students to clinical rotations for 6 weeks and they move locations, but they're all in the same spot. So the occupational outlook is fantastic as a pathologist assistant. The weird thing about this field is that the US Bureau of Labor Statistics actually doesn't recognize the pathologist assistant profession because we're so small. They can't create enough data based on only 3,000 individuals versus there's 1 million doctors in the US. So the US Bureau of Labor Statistics doesn't have criteria for our field. However, RFU every year, our students have 100% job placement rate after graduation. So my students right now are about 6 weeks out from finishing their clinicals and they officially graduate in June. I was just looking at our checklist earlier today, and about 20% of our second year class already has a job. When they come back in 6 weeks, when they finish clinicals, we have them come back on campus for final presentations and exams. Typically, about 95% of the students will be employed at that point. So the job outlook is fantastic. There's plenty of jobs for PAs. The caveat is that it may not be in the geographic location that you maybe grew up in and wanted to go back to. So, for example, where I grew up, outside of Rockford, Illinois, there's three main hospitals in Rockford. That means there's only three PAs that service the entire city of Rockford. So it is challenging to maybe go to a specific geographical location just based on availability. However, the jobs are there. You just may have to go to them. The median starting salary, our students report receiving on average about $100,000 for a starting salary. Within the last couple of years, we're seeing this creep up. So it's getting closer to about 110 right after graduation. So you can, again, work in a variety of settings, whether it's in the hospital or in medical examiner's office, sales, what have you. So there's plenty of opportunity for a PA. So many of you on this call probably had no idea that a pathologist assistant existed, which is okay because we are this hidden entity. We work typically in the basement of a hospital. So many people don't realize that this is something that you can pursue. And when you ask a PA how they discovered pathology, it usually starts with, I had no idea that this existed until XYZ, or I was pre-med in undergrad until XYZ. So I kind of fell under both of these categories. So I didn't know that pathologist assistants existed until I was almost done with my undergraduate degree. So I was pursuing becoming a medical laboratory scientist, which are the individuals that work on the clinical side of the lab, and they're responsible for running all of the blood, urine, and body fluid samples. So that is what I was headed into. And then I kind of stumbled upon a pathologist assistant when I was touring a hospital for my MLS clinicals to decide if that is where I wanted to go. And her name is Carla. She kind of took me under her wing, but I saw Carla grossing a specimen and I said, who are you? What are you doing? I need to be doing what you are doing. I was absolutely enamored with um, for lack of a better word, getting your hands dirty and being intimately involved with the specimens and the anatomy and the pathology. It was everything that I wanted to do, but I just didn't know that it existed. So stumbling across Carla in the lab that day totally changed the trajectory of what I wanted to do with my career. So I finished my bachelor's degree as a medical laboratory scientist. But about halfway through my senior year of college, I applied at RFU, um, and I was lucky enough to get in. I truly, it was kind of a last minute decision. I said, you know what, I'm going to apply, throw my hat in the ring, see if something sticks. And it all worked out. I was accepted and I graduated in May, and then I had 10 days from the time that I graduated at NIU to the time that I started at RFU. So I just kept on going. But I went into being a PA or being a pathologist assistant, and I realized that my passion truly was in education. My favorite part of my day was when I was either teaching a resident or one of our pathologist assistant students or one of our techs. That was really what I looked forward to the most. So I said, you know what, let's keep an eye out for an opening at RFU. Let's just see if something becomes available, thinking that this would be several years down the road. But it ended up becoming available much sooner than I anticipated. And I applied to be a faculty member at Rosalind Franklin University, and now I'm here. So now I am an instructor there, and I teach pathologist assistant students on all of the inner workings of being a PA. And I've been there for about 4 years now, and it is an absolute joy. I get to share my passion with the field and with healthcare in general with aspiring young pathologist assistants. So if you, after this presentation, have any interest in learning more, here's some additional resources. that are available to the general public. You can look at the AAPA's website, ASCP. NACL is looking at the program, so these are available to you. So thank you so much. I'll stop sharing my screen and we can answer any questions.
Also, if you guys want to raise your hand, Nicole can pick you and you can ask your questions. But I'll start with the questions on the chat. So Manasvi asked, actually, first question was, what were your steps or experiences that helped you successfully shift from clinical practice as a pathologist assistant into teaching role?
That's a great question. So, part of our education is teaching based. So, since many PAs end up in teaching roles down the line, that is part of our curriculum. So, I did have some um, practice and some background knowledge as a student. And then in my clinical rotation, I was working with residents as well. And then in my full-time job. So, I had some teaching experience in the actual clinical setting. But moving into academia, it was a very big shift. It was a big learning curve. But I have an incredibly supportive team that took me under their wing and showed me the ropes. Um, but it's been a journey, and I have really enjoyed the journey.
Amazing. So the next question is from Manasvi. Sorry. What are the most challenging specimens or cases to work on?
Ooh, there's there's so many different challenging cases, and everyone's answer looks a little different. I think that head and neck cases are particularly challenging. The resections, there's so many different margins and anatomic structures that making sure that you document everything and that you maintain your orientation. I think those particularly are difficult. Others may say that breast specimens are particularly hard. For me, I think head and neck is the most challenging.
Another question again from Manasvi. How do you ensure accuracy and attention to detail when processing a large or delicate specimen?
That's a great question. So, with being a mid level provider, we're never on our own. So, we can always work with our attendings if we're unsure how to handle a case. Maybe it's very complicated or disrupted. But there are resources online. So, I utilize the College of American Pathologists. So, they put together a protocol for that the pathologists use. So if I know on that protocol all of the things that I need to show and prove to the pathologist, I go through that checklist and make sure that I have everything that way. So utilizing your attendings, utilizing those checklists. There are textbooks and grossing guidelines that are available that we can utilize as well. But keeping yourself oriented takes a lot of practice and being organized. Nothing is a race except for frozen sections. Those are a race. But everything else, you can take your time and work through to make sure that you're keeping yourself organized. But being type A, again, I consider myself a type A individual where I'm uh, keeping all of my ducks in a row, making sure everything is organized as best as I can.
This is another question. This is for me. How often have you seen cases where endometriosis significantly is involved or filled organs, such as over or bowels? How have you seen have you seen different organs besides these specifically?
Absolutely. So endometriosis is a beast. It can certainly be anywhere in the body. I think the most common place that I see it personally in the gross room is ovaries, and within the actual muscular layer of the uterus called the myometrium. I think those are the two most common places, but I have seen samples of endometriosis from the lung. I have seen it from the GI tract, so on the bowel. I've seen it on the omentum, which is a protective covering of your internal organs, of the abdominal wall, just in itself. I've also seen samples in the brain. So it is certainly a tricky disease.
Okay, so I think Abigail just wanted to put this out there that it reminds her of the scans that they have to do every 15 minutes. I don't know what that is entailed to. So Abigail, if you want to let me know what that is about. Okay, the next question is Shay. How should we go about obtaining shadowing hours? Do we email the pathology department of a hospital?
So you can certainly cold call or cold email and reach out to pathologists at your local hospital. Reach out to either your medical examiner's office or your coroner's office to see if you can shadow a autopsy that way. If you're having trouble, you can certainly reach out to me. We have a handful of PAs in the Chicagoland area that do virtual shadowing of the gross room. So if you're having trouble, I think best thing to do is reach out to your local hospitals and those local government offices, the ME office or the coroner's office. But if you're having trouble that way, you can certainly email me and we can get you connected with some Chicagoland PA.
Another question from Manosvi. How does the role of pathologist assistant evolved since you started?
Ooh, since I've started, so I think the big push within the last 10 years has been more involvement of pathologist assistants in autopsy-based roles. There is a national shortage of forensic pathologists. So those are the pathologists that specifically work in autopsy. So with the limiting factor of the amount of forensic pathologists that are available, they're leaning more on pathologist assistants to participate in autopsies, particularly in forensics. So I think that's the biggest change that I've seen. Um, I think the next change that we'll see is the introduction of AI and other technologies in surgical pathology. I don't think that anytime soon a PA would be replaced by a machine. But there are other machines that can be integrated into pathology, like imaging devices, lymph node searching devices that we can utilize to help improve the outcome of our grossing technique.
Question is from Alexia. Are there specific areas you specialize in, such as PA specialize in neurology, cardiology, podiatry, or are you trained to work and know all areas?
So we are trained in all areas. So typically PAs don't specialize in breast or in peds or in gyne. We know how to handle all of these types of specimens. There are some very large academic institutions, such as the Mayo Clinic, where the PAs that work there do become subspecialized. But that's after a few years of kind of being a general PA. But that is very unique to the Mayo Clinic in general. We gross and handle all specimens.
Question is from Michelle. Since there are so few pathology assistants worldwide, why don't programs accept more students to increase the number trained and prepare for per cohort?
That is a great question. If we could take 100 students, we absolutely would. But a huge limiting factor for us in particular is the space that we have available and the amount of faculty that we have. So with the fact that there's been there's double the amount of pathologist assistant programs that are available now, we're definitely graduating more and more PAs. But with the fact that we are such a hidden profession, many actual old school pathologists, they prefer to handle their cases themselves. So some hospitals don't have PAs. So it's definitely changing and it's growing much quicker than it ever has. So if you think about the profession being around for about 50 years and in the last 10 years having double the amount of programs open, it is certainly growing very quickly.
The question is, what's something you wish someone had told you before you started working in surgical pathology?
Ooh, It's certainly tough on your body. Um, I am one that likes to stand while I work. So by the end of the day, my body certainly hurts. So making sure that I had the appropriate socks and the appropriate shoes to kind of limit how the pressure on my body and utilizing appropriate ergonomic technique and tools. So I think that having a little bit more of a warning, what I could have been more proactive and not hurt so much at the end of the day.
Chloe's asking, is it possible for PAs to offer internships for undergraduate students, specifically as a beginner role like pathology technician?
So there's no internships that I am aware of that are available, but many individuals that want to go into this profession will take a job as a pathology technician first. So looking for those jobs in your area, they are either called pathology technicians or pathology assistants. It's kind of a variety of names that are available, or maybe a histology tech. So searching out those jobs, maybe if you're in between your undergrad and kind of deciding what you want to do, you could take a job such as that.
This is for Chloe again. Can PAs work specifically under a forensic pathologist or under a neuropathologist?
They certainly can. So it is not a very common role. An instance that I can think of that happened most recently, we had a graduate a couple years ago that she actually created her position. It didn't exist before. So she works at the Iowa Office of the Medical Examiner. So she works directly under forensic pathologist. So most of those jobs don't exist yet, but they certainly can be created and advocated for. And I think that is where some of the profession is moving forward. Um, I don't know of anyone specifically that works under a neuropathologist, but it is certainly an avenue that could be pursued.
How much independent decision making do pathologist assistants have?
We are essentially completely autonomous at the bench. We can make any decision that we need as long as we can justify why we're making that decision and following the parameters in order to appropriately handle a specimen. But if there's ever a situation that I don't know what the answer is, or I'm not sure if I need to make a left or a right, I'm certainly consulting a pathologist. But 9 times out of 10, I'm making the executive decision at the bench.
Another one question. How do you handle days? I'm sorry. Handle days with emotional heavy cases.
That's a great question. Um, I think the days that are the heaviest are the days after doing a handful of autopsies, particularly pediatric cases. Those can be very emotionally heavy and tolling on an individual. But the great thing about being a PA is that we're not on call. We get to go home and leave our work at the hospital, and we get to have that separation. So that's really important in making sure that you have a strong support system. I always encourage going to therapy, especially if there's been a very significant case that's been weighing on you. But being able to step away from work and having a life and priorities and hobbies outside of work helps maintain that balance. But it certainly can be tolling. I think as PAs get used to the day to day, we kind of get desensitized to some of those heavier cases, but every now and again, there will be one that kind of hits you a little harder than another.
Chloe's asking what best study tips for grad school that you would have.
Practice, practice, practice. Um, Being a graduate student is a completely different beast than being an undergraduate student. The expectations are much higher. The amount of information that's being thrown at you is much greater than in undergrad. You could be in class from 8 to 5 all day long, but then you still have to study all of that material. The There is a book that I think would be great for not only graduate students, but high school students, undergraduate students. It's called Make It Stick, and it's about making the information stick in your brain. And the big component from that book is your time management and time blocking. So saying if you have 4 classes that you need to study for, then you have 4 hours that you have available for you. You designate 1 hour for each one of those classes. Once that hour is up, regardless of how much you've gotten through, you have to move on to the next task. Making sure that you're going back and forth to content and you're never leaving something kind of sit on the back burner for too long, that keeps that information in the forefront of your mind. But I highly encourage anyone on this call to reading the book Make It Stick. I think it is a great tool for any learner.
How has your experience in high volume surgical pathology influenced the way you teach students today?
Ooh, I think my experience at the high volume labs, knowing, hmm, knowing how to manage your time efficiently in order to get through your caseload. So when I was in the academic or the community hospital, I was the only one grossing. So I had to make sure I could get through my entire caseload every single day just by myself. So taking the tips and tricks that I learned in order to manage my caseload by myself, I now can impart on my students and let them know, okay, maybe you can get more concise, be more specific with your dictations and kind of cut out some of the unnecessary content. So I have taken that from the clinical setting and imparted that on my students.
What is the easy? This is from Yajaria. Sorry, I don't know if I pronounced it correctly. What is the easiest way to get in touch with you?
So I will these slides be shared, Jennifer?
We have the video. But we can also share it in we can share it to our website, or we can if they can email us, and we can also share email.
Yeah, so my email is in those slides. If you go to Rosalind Franklin's university's website, my email is also on the Pathologist Assistant faculty page there. So you're more than welcome to shoot me an email and I will get back to you as soon as I can.
This is another question for you. What current discussions or developments in the PA field are you most excited about?
I think the integration of new technology in the pathology world is something I'm super excited about. I think the all of the advocacy work that many PAs have done in order to push our boundaries of our scope of practice and being more involved in forensic, I think is a really exciting thing to see in its infancy and its development. So I think those are the two areas that I'm most excited for in the next like 5, 10 years or so.
Amazing. So Manasvi also put on the chat box how you can get the slides if you want them after our presentation. Also, another question is, from Chloe, does working around a lot of disease and sickness make you feel sense of impending doom regarding your own health, or make you feel like a hypochondriac?
That is a great question. So, the hard part of having all of this knowledge is that we have no filter. So, I experienced this with my mom in the last year. She was diagnosed with breast cancer. So, I know all of the ins and outs of breast cancer. So, it's incredibly difficult to create a filter for myself when talking to another individual. I don't think that it gives me a sense of doom. I think it gives me a sense of empowerment, having the knowledge and understanding of all of these different pathologies and being able to advocate for screenings and making sure that everyone is taking care of themselves, and being aware of the tools that are available for them. So I don't think it's necessarily a sense of doom. The hard part is having almost too much knowledge and not being able to filter out some of the things that I don't want to have to think about, especially when it comes to like my own friends and family.
This is another question. What's a misconception about your work that you try to correct in your teaching?
That we don't have an important part in a patient's care and that we aren't part of a patient's holistic care journey. I teach one of our seminar courses is completely based on how we participate in holistic patient care and how we treat a patient, not just one part of the patient, but the whole patient. So I really try and correct that with my students, and that they have to treat each specimen as their entire patient, and that each specimen has a story and a background, and each patient belongs to a family. They have children or spouses or loved ones. So I think that that is the biggest thing that I try and impart in my day to day.
If you had to describe your work in 3 words, what would they be?
Ooh, fulfilling, messy, and important.
When working with clinical specimens, what's one part of the process you emphasize to students as critical for patient outcomes?
Making sure that they understand the why behind the what. So, understanding why they're making a certain cut or why they're describing a certain relationship or taking a specific measurement. Everything that we do, there's a reason behind it. And if they don't understand the why, then they don't understand what they're doing. They don't understand the importance of how their words, their sections, their measurements correlate to patient care. So making sure that they understand the why is really important to me.
And Osby has her hand up. She has a question.
Hi, Nicole. It was great
Hi.
hearing about your work. One question I had for you was, how do you balance giving constructive feedback while also keeping the students confident and motivated?
That is certainly difficult, but I think that since I'm with these students for their entire 12 months, we build a strong rapport with one another. I'm never trying to tear a student down. I'm always trying to make sure that the feedback that is given boosts their confidence and that they have the freedom to make the mistakes during their didactic year so they feel confident going into the clinical year when they're handling actual patient tissue. So allowing them to make mistakes but correct them so they feel confident and empowered with the knowledge that they now have.
Alexa has this question. What do you wish other clinical staff knew about PA, sorry.
Well, that we exist, for one, I think is a huge thing that I wish that nurses or even surgeons, many surgeons don't realize that we exist either. So other healthcare providers understanding that we exist and our role that we play in the patient's care.
Can you walk us through your workflow from receiving a specimen to preparing it for pathologist?
Of course. So I can use the lumpectomy example. So if we had at the beginning of the day, we get the surgical report or the surgical schedule, and we know every single surgery that's taking place that day. We are responsible for reviewing the patient's charts to understand why exactly they're having that procedure. So if a patient had a lumpectomy scheduled, I would review their clinical history and see if they had a biopsy, what that biopsy result was, how long ago that was, looking at their imaging results. So creating a picture for myself of what exactly I'm expecting to receive. Once we receive that tissue in the lab, breast is a particular one that we have to kind of stop what we're doing because that sample has to get placed into formalin within 60 minutes of it being removed from the patient because there's specific testing that has to be done on that sample that if it's outside of the 60 minutes, we call it cold ischemic time, then the tissue degrades too much. So once it's taken out of the patient, it starts dying essentially. It's lost its blood flow. So we have to put it into formalin so it kind of freezes that dying process. It freezes the cells in whatever stage that they are at that point. So I will triage. So what that means is I will ink my specimen take some preliminary measurements, section it, and then I'll put it into formalin and come back to it in a couple hours. After it's fixed for a while, I'll take out the specimen from formalin. I'll get into the patient's case and I'll dictate everything that I see. So talking about the mass, what colors I used for the ink, how far away the mass is from the margins, what the normal tissue looks like. And then I'll tell my pathologist what samples I took, create my cassette summary, and then those cassettes get put into a large processing machine overnight. It usually takes about 12 hours, if not longer, to process the tissue. And that tissue dehydrates and then is embedded in that wax and goes to the pathologist. So that's kind of where my part stops, is that when the cassettes go to histology, that's the end of the pathologist role, the pathologist assistant role.
We have one more question. How do you handle unexpected findings in a specimen?
There's always unexpected things that crop up. A case that I had a couple years ago, I received a lung specimen that I knew had one type of cancer. I was expecting to see this mass, but when I was sectioning, I came across something else that I was like, that doesn't look normal, but I have my other mass that I was expecting over here. So you have an idea of what you're expecting to see, but sometimes these instances come up where there's something else that was unexpected. So making sure that I'm documenting that in my dictation, I'm taking a section of it, maybe taking a picture. So then that can go along with the main pathology and making sure that the pathologist has the most accurate information. In that case that I had, the patient ended up having two different types of cancer within the same specimen at the same time. So making sure that we know what normal looks like is really important, so then we can identify when something is unexpected and isn't normal.
Wow, another question from Minosby. How do you stay focused during long procedures without cutting corners?
Remembering that my case is a patient. It's part of a patient. I was working on a case last Saturday that took me 4 hours. It was a very long, tedious procedure, but I knew that I couldn't cut corners. I had to make sure that I met all of the parameters so that this patient received the best care that they possibly could. It didn't matter that it took me 4 hours. So making sure that you keep the patient at the forefront of your mind is the best way to move forward through some of those long days.
Ricardo has his hand up, so he can ask you a question.
Yeah, that's Richard.
Sorry, Richard. I'm so sorry, Richard.
It's okay, it's okay, it's okay. No biggie. Okay, I got multiple questions. So, first of all, I've been looking at the pathology schools, namely Loma Linda. They said that for your undergraduates they want a bachelor's in life science. Does that include like say biology degree?
It could, absolutely. So I'm not super familiar with Loma Linda's application requirements, but I believe that biology would fall under a life science degree.
Yeah, so I'm sorry to interrupt, but what kind of bachelor's degrees do they typically do the assistant pathologists look for?
Many of our students have some form of a biology degree or chemistry degree. Some have a forensic science degree. So it's mostly science-based, but we do have students every now and again that have unique paths to becoming a pathologist assistant. So they might have like a history degree or something along those lines. So it's typically a science-based degree.
Yeah. Yeah, because because I want to make sure I maximize the best chance possible, because I'm right now I'm currently in a kind of community college, and I'm in a process of transferring to a UC, and I already went through biochemistry, organic chemistry, general chemistry, biology, microbiology. I already went through all of that and aced most of them. So another thing, do you also help in diagnosing infectious diseases or parasitic diseases, things like that?
So that's mostly in the clinical side. We are trained on sterile technique and collecting tissue for microbiology and other special studies like cytogenetics and molecular. But I guess in autopsy, we do collect microbiology specimens to work up to see if a patient had some type of infection. So in that aspect, we participate in infectious disease.
Yeah, yeah, because that's kind of where my interest is right now in terms of pathology. I've already had practice in laboratory techniques. I've done some biotech classes and practice, and I've done like petri dish culturing. I've done cell culturing in one of my internships. So I guess I'll be looking if I was to go to the assistant pathology program, I might be looking at clinicals if I wanted to get into that kind of work, huh?
Yeah, I would suggest looking into a medical lab science program. So that's mostly where like a microbiology department is going to be. But you certainly can work in infectious disease. It's just going to look a little different on the pathologist assistant side.
So it's a medical lab science program?
Yeah,
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 let me just write that down.
yeah, please.
Okay, does anybody else have any more questions? Because we're about to wrap it up.
Yeah, thank you so much because right now I'm kind of like in a crossroads. I don't know where I'm looking at, but the
Yeah.
assistant pathology is like one of the things that I have my eye on. Sorry if
Oh,
I if,
absolutely.
sorry if I sound kind of goofy, because for some reason my speed program, it's like I'm not good at talking right now.
That's okay. I appreciate your questions. And if you have any other questions about either being a pathologist assistant or an MLS, let me know because I am both.
Yeah, thank you so much.
You're welcome.
Does anybody else have any more questions? If not, we're going to start wrapping this up. So what I'm going to do is just going to show you the wrap-up slides to kind of give you information about the quiz and just a little bit more information about ourselves. And then once I'm done, we're going to have a couple minutes. If you have any questions that you might want to ask some of the pre-health shadowing volunteers or Nicole, we'll stick around for a little bit. So with that, let me share my screen and get that going. All right, so let's reflect. As we wrap today's session, let's take a moment to reflect on our journey together. Think about what resonated with you the most. Was there a particular moment or example that truly captured your interest? Feel free to answer these questions in the chat or share as a reflection on the PHS website. Sharing your insight on LinkedIn is really valuable. So if you want to share today's session, showcasing what you learned, but also connecting with like-minded professionals, remember to tag pre-health shadowing, using pre-health shadowing to amplify your reach and start meaningful conversations is a simple act and significantly enhance our professional network. If you're interested in being part of pre-health shadowing, we'd like to repeat that if you're interested, you can do so remotely and contribute from anywhere in the world. To get started, just register on our website to gain valuable experience and make a positive impact for the pre-health shadowing field. If you have any questions, feel free to ask or visit our website. If you can donate, we'd really appreciate it. There's help our program stay free, accessible to everyone. We run solely off the time and donations of volunteers. So here's a way to earn their certificate. Don't forget to take our post-shadowing assessment available after this session is done. By completing this, you'll receive a course certificate completely free of charge. The assessment itself is simple 10 questions, multiple choice, quiz-based on the presentation. This is a fantastic opportunity to add to your professional credentials and showcase your commitment to learning. Did you miss part of the session today? No worries at all. We got you covered. You can visit our YouTube channel at Pre-Health Shadowing to watch any of our previous sessions for free. Remember that our goal is to provide accessible learning opportunities for everyone, so feel free to explore the channel at your own pace. And be sure to catch our session next week. We'd love for you to join our next session. We have one every week. It's a fantastic opportunity to learn and connect with like-minded individuals who share passion for healthcare. You can do so by reading and signing up for our newsletter, following our socials, and regularly checking our PHS website for upcoming sessions. And finally, as we wrap up, I want to emphasize how much we value your presence here at Pre-Health Shadowing community. You are what makes the session vibrant and meaningful. Thank you so much for joining and supporting our mission. All right, guys. So if you guys have any, wait, sorry, unshare my screen. Sorry, guys. If you guys have any questions, feel free to stay. We're going to stay back for a couple minutes. Thank you so much for showing up to our live. Thank you, Nicole, so much. I really appreciate it.
Thank you.
Thank you. Thank you so much for your time and information.
Absolutely.
Does anyone have any final questions before we end the meeting? Okay, yeah. Thank you so much, Dr. Nicole. It was so nice to see you and learn about your work. And yeah, I think you can end the meeting. Thank you, volunteers.
Thank you so much. Bye-bye.